Well, on the one hand, in Europe, we have, because of our demography, we have an enormous growing problem of dementia and Alzheimer's disease because people are getting older and so on. Secondly, diabetes, heart diseases, mental health. These are the big issues. So, in other words, chronic diseases. And a second correlate of that is that our health systems basically are on a train wreck scenario, whether they're funded fully by the government like in the UK or insurance based like here, it doesn't make a difference. And it's time now that we're going to concentrate on health and not only on disease. So of course we need equal access to healthcare, and that is still a challenge in many places. But also we need to work upstream. In other words, we need to start very early on that our children and then adolescents and adults don't become obese, there's a healthy lifestyle and so on, and that has been completely neglected, and that requires solutions that are far beyond and outside the medical sphere. Well, this World Health Summit is quite unique gathering of people from various sectors dealing with health. Medical professionals, public health officials, policymakers, young people this year, a lot of young people, I love that, and also people from industry. And what I have been most impressed with today is that there is this real growing understanding that we need this whole of society approach. Far more emphasis on well-being, on healthy living, and going out of our comfort zone as medical people. And there were several sessions that illustrated that we can really make a difference if we start very early and if we also deal with all the unhealthy lifestyles from smoking to healthy living. Plus, of course, making sure that the products of science and technology are accessible to everybody. Well, conferences like this, what's going on in the corridor is always as important as what's going on in the meetings, in the sessions. And so new contacts, new networks, and particularly new ideas for me, particularly when it comes to how to deal with the chronic disease of our time, so that we really need to involve the lawyers, the industry, policymakers of all kinds that we normally not deal with in health.